Let's talk about x-rays. You've probably had one, but have you ever stopped to think about how doctors get that perfectly clear picture of your insides while also making sure it's completely safe? Well, it's this incredible balancing act, and we're going to dive into how they pull it off.
I mean, it's a pretty basic question, right? When something's wrong, a bone feels broken, or there's a pain you just can't place, what's the go-to tool for doctors to actually get a look inside?
Yep, you got it. The X-ray. It's this amazing piece of technology that lets us see right through skin and muscle to the hard stuff underneath, like our skeleton. It's been a game changer in medicine for, well, over a century now. Okay, and this is the crucial part. X-rays involve radiation. Now, it's a very small amount, but there's always some risk. So the real trick isn't just snapping the picture, it's getting a perfect picture using the absolute minimum amount of radiation possible. And that leads us to what's known as the radiographer's dilemma. These are the experts running the machines, and every single time they're weighing two things: getting a super sharp image for the doctors versus keeping the radiation dose for the patient as low as it can possibly be. Think of it kind of like a seesaw. If you crank everything up for a perfectly crisp image, the radiation dose tends to go up too. But if you drop the dose too low, you might get a fuzzy picture that's no good for a diagnosis. It's all about finding that perfect sweet spot right in the middle. And this isn't just some casual guideline. It's a whole philosophy baked into their training. It's called the ALARA principle. It's an acronym that stands for as low as reasonably achievable. It's the golden rule that patient safety always comes first. So how do they actually control this balance? Well, you can think of it like they have two main control knobs on the X-ray machine. They're the key to everything, and they're called kVp and mAs. So breaking it down is a two-step process. First, they have to set the power of the X-ray beam. How strong is it? How well can it get through your body? And second, they set the quantity, just how many X-rays are they actually going to send out. Now for the technical terms. That power is controlled by something called kVp, which stands for kilovoltage peak. That's the quality of the beam. The quantity is controlled by mAs, or milliampere-seconds. That's just the sheer number of X-ray photons. So you've got quality versus quantity. Simple as that. Okay, so we've got our two knobs, power and quantity. But how does tweaking each one actually change the final picture the doctor looks at? This is where things get really interesting. A radiographer came up with a fantastic way to think about this. They said, kVp is the punch. It's how hard each X-ray hits. And mAs is just the number of punches you throw. A powerful punch versus a whole lot of punches. So here's where that trade-off kicks in. If you use less punch, so a lower kVp, you get amazing contrast. The bones look super white and sharp against the background. But, and it's a big but, if the punch is too weak, it might not even make it through the part of the body you're trying to X-ray. And this shows it perfectly. Look at the image on the left. That's a low kVp shot. See how sharp and distinct the bones are? Super high contrast. Now look at the right. That's a high kVp image. It's a bit softer, more shades of gray. That's lower contrast. Both can be useful, but they look very different. For years, the rule of thumb was, if you want good contrast, you gotta use that lower kVp. But that usually meant you had to use a higher quantity of X-rays to get a decent picture, which of course means a higher dose for the patient. So some researchers decided to ask, with today's digital X-ray machines, does that old rule still hold true? So they asked a really simple but really brilliant question. What if we flipped the whole thing on its head? What if we used a much higher punch or more kVp? That would let us use way fewer X-rays overall. The goal was to seriously cut the radiation dose, but the big question was, would it destroy the image quality? Well, the results for the patient dose were absolutely staggering. By cranking up the kVp and lowering the mAs for pelvis X-rays, they cut the patient's radiation dose by an average of almost 47%. That is a massive, massive deal for patient safety. Okay, so slashing the dose by nearly half is amazing news. But that brings us right back to the dilemma. Did they have to sacrifice the picture to do it? Did they end up with a washed-out, useless image that a doctor couldn't diagnose from? And here is the kicker. This is the amazing part. The image quality wasn't just good enough, it wasn't compromised at all. In fact, when a team of senior radiographers rated the images, they found that the new, low-dose pictures were, on average, actually a little bit better. And here's the proof in the numbers. They used a scoring system to grade the images. The old school low kVp method got an average score of about 11.3. The new high kVp low dose method, it scored a 12.55. So yeah, the data backs it up. The pictures actually improved.
So what does this all really mean? What's the real-world impact for you and me? Well, it's all about finding smarter ways to do things that lead directly to safer healthcare for all of us.
And it's so important to remember this study used real images from a real hospital. It's not just a theory. It proves that a simple tweak to the technique, one that's possible because of our amazing new digital technology, can make a huge difference in patient safety with basically no downside. So let's just boil it all down. The big takeaway is this. Using a higher punch with fewer X-rays is a fantastic way to slash the radiation dose. And thanks to modern digital systems, we don't have to worry about losing picture quality anymore. It really is the best of both worlds, a total win-win for doctors and patients. You know, we just took a deep dive into one specific tweak in one type of medical imaging. It kind of makes you wonder, doesn't it? What other little hidden dilemmas and clever solutions are being worked on right now, behind the scenes, making the technology we all depend on safer and better every single day?